woke up looking for the broccoli. High key, keep a horn on me, that could my seat. I peep, ownership, the blueprint is by me. Mr. Get Off, I get off at my feet. A ye nigga couldn't try me in a tri-state. Buddy pass, but I get him splashed till he hydrated. Down south, know he spook town, eyes dilated. I got the money and the power, both gyrating. I feel good, get the fuck out my thighs. Look good, but she don't got no ties. I walked in, walked out with the size. Man, don't let me know what the prize.
Hey, so we at the gym now. My gym doesn't have AC, so I'm fully dressed. I mean, my gym doesn't have AC or heat. So yeah, I still got my sweatpants on. I wore long sleeves today. When I'm breaking up of a sweat, what's up with this? When I'm breaking up of a sweat, then I'll take my sweatpants off, wear my shorts. But yeah, it's back day. And I mean, ain't much talking to do. I'm about to get to it. Okay, y'all, as you can see, I've had a whole morning so far. I went to the gym and then I went to school to do a little bit of lab work, and now I'm back home. It's 10:52, which means I have, give or take, a little bit over an hour before I need to head to my externship site. And I just wanted to talk a little bit on the camera before I take a shower. I'm about to eat, need a nice little post-gym meal. But I just, since the title of this vlog is Life After Externship, I did want to explain a little bit what's going on between now and when I graduate from dental school in May. I mean, not life after externship, life after matching into orthodontics. So, a few things. Number one, I obviously still have requirements at school and things that I need to get done in order to graduate. Not only that, I still have a second part of my licensure exam that I need to pass in order to be licensed as a general dentist. Although I'm going on to Orthodontics Residency, it is still required that I obtain my license as a general dentist in order to go into my specialty training program. So, to get a little bit more information about my externship, you can watch the Week in the Life vlog on externship that I did recently, and I'll link it up here. At my externship, I still do all things general dentistry, crowns, dentures, fillings, even cleanings. And while it might feel slightly annoying because these are things that I am literally never going to do again after I graduate, it's still very important to learn the basics of clinical dentistry. I remember when I first went to my orthodontist office after college, when I was pre-med and I had not had any type of inclination of wanting to switch to pre-dent yet. And I remember my orthodontist saying, "You need a cleaning." And I was like, how does she know? And I'm like, that was literally, I mean, I didn't say that to her, obviously, but in my head, I'm like, how does she know? Like, she just does braces. That was so ignorant. Not only do you have to be excelling in school, in dental school to become an orthodontist, they have done all this stuff before when they were in dental school. So, yes, she knows very well. And if you think that your orthodontist doesn't know anything about dentures, crowns, etc., you're sadly mistaken. And I'm not saying that to get on you. I'm just letting you know this is how it is. But, of course, on top of that, I want to mention that now, since I am pretty on track for finishing my requirements early in the next semester, I do want to focus the remainder of my time in clinic on things that I will be doing in the future. So I do have a few Invisalign patients, and I've showed one on the channel before because he's my friend. He's a second year student, Mo. And one thing I'm really looking forward to is continuing with Mo's Invisalign case. I had Mo show like his progress in one of my previous vlogs, which I'll also link in here if you guys want to go watch that. But I'm really looking forward to seeing how that case comes along. And that will kind of be my first real orthodontic case as a dental student. And I do have a few others. Because I'm on externship, they transfer your patients and I can't really keep up with that one anymore. But, you know, yeah, it's just pretty exciting to see things coming along. And I am looking forward to next semester where I can kind of focus my clinical experience on orthodontics and finish up my requirements and all that stuff. I think now I only have 3 more weeks left on externship, and this week is Thanksgiving break, so it's really like 2.5. I do want to focus my externship experience on things that I enjoy doing and that I will find helpful in the future. Number one being operative, because I still have the operative portion of my licensure exam that I need to take. So I do want to continue to build my experience with that, recognizing caries, etc. Removable prosthodontics, dentures, there's a lot of impressions and things associated with that. And of course, as an orthodontist, if there's one thing you gotta be good at, it's impressions. Even though we're moving more to the digital age, it's still important to know how to do analog impressions with alginate material, whatever material you're using. So that's something I definitely want to focus on. Of course, I will still be doing fixed prosthodontics like crowns, mainly because I can get credit for what I do on externship at school. So if that can kind of move my requirements along even more, I am down to do that for sure. So that's kind of what externship is going to be looking like for me for the next 2.5 weeks. And this is life after matching into orthodontic residency. So I'm about to heat up my food, eat, shower, get dressed so I can go to externship. I have so much fabletics. I can't wait until I move to Indianapolis and I'm able to afford a larger apartment at a cheaper price than Boston. And I have an actual closet, like a walk-in closet. That's one of my non-negotiables for my Indiana apartment. And I can hang up all the scrubs that Fabletics sent me. Because another thing on externship, I don't have to wear those gray school scrubs that I wear to school. I don't like them. They're high waters. They don't fit well. I like the Janu Fabletics Figs feel. So one thing about externship is I like to wear whatever I like to wear and they don't mind. And at my residency program in Indianapolis, we can wear whatever scrubs we want. I literally have enough scrubs that I could wear different color scrubs every day for a month. So I'm looking forward to putting some fits together, maybe starting to do some stuff on TikTok with that. Just doing fun stuff for my patients, because you know I'm going to be working with young adults, teenagers, people that I can literally relate to and have the same impact on their life as my orthodontist, Dr. Callahan, did for me. So I'm looking forward to that very much, and we can talk more, but I'm wrapping right now. It's time for me to, you know, hurry up and get ready to head out so I can go to my externship site, and that's pretty much it. So let's keep the day rolling. All right, y'all. I'm all dressed and ready to leave the house to head to my externship. Go to the outfit of the day, you feel me? I got a backup so far. Maybe I can just, hold on. All right, outfit of the day, all Fabletics. I got the Fabletics Seal Blue Under Scrub, Fabletics Navy Blue Joggers. And then I got on some, oh, you can see that, okay. Nike P6000 Silver. I love Nike. If Nike has scrubs, I would wear them. Yeah, we about to head out the house, go to externship, and oh, I forgot to mention, I also have a Friendsgiving to go to tonight. So y'all have seen like the row that I usually sit in class. If you watch my vlogs, D1 year, D2 year, D3 year, we always sat in the same row. Me, Kofi, Hallie, Rachel, Elizabeth. You know, we have a little Friendsgiving before we leave for Thanksgiving break, but I want to give a shout out to Rachel and Elizabeth because they both also matched in orthodontics. Both of them are staying in Boston. Elizabeth is going to Tufts University. That's another 2-year program. Rachel's going to Harvard. That's a 3-year program. So shout out to them. We really did it. And this calls for celebration. Super happy for them, super proud of them, super excited for all of us, honestly. Like, everything is coming together. All our hard work is coming together, and we're getting ready to graduate from dental school. It's crazy. So let's go. All right. Just pulled up to the externship site. I guess they're doing some type of construction or something because it's mad loud and they're drilling on the street and whatnot. But right now it's 12:47, so I'm a little bit early. Taking my sweet time getting up there. Hopefully we have a light day today.
Like you as much as you like them, and pretty much you rank like who you like the most to the least, and then they rank you, and they usually go with the person, but there's spots of like
Are you nervous?
I am. Wait, what is this thing called?
DJI Pocket.
This is so cool.
Okay, introduce yourself first.
Okay. Hi, my name is Tara. I'm a 4th year at HSDM.
H stands for
Harvard School of Dental Medicine.
Thank you. And Tara matched into?
I matched into perio after a long 3.5 years, and I'm going to Virginia Commonwealth University.
Mm-hmm. So what I was explaining to them about after matching is not sitting on your butt.
It is sitting on your butt right now.
But like, kind of what I was explaining is now that you know what you're going to be doing next year, right?
Yeah.
You can kind of focus your remaining clinical experience more on what you're going to need for the future,
exactly.
right? And like the rest of your externship experience, I mean, obviously, like you still have requirements, all that stuff,
Yeah.
but now you're like, okay, what I really want to get out of this externship is
what?
blank.
Yeah,
So-
like you could, I think a couple of us are like going both ways, that some of us want to do more things that are focused on what we're going to be focused on later, but then I feel like us three are like, oh, we're not going to be doing crowns, or we're not going to be doing denture stuff, so we want to get as much experience we can get now, because I mean it's good for us to know. And then
I literally
for the
said the
future.
same thing.
Yeah.
Okay, well, so explain to them like what perio
Perio
like
is.
like as a specialist in periodontics, like what are you going to be doing?
Yeah. So I think, I feel perio's, a lot of people are like, if you're doing perio, why don't you do oral surgery? But for me, I wanted to do perio because I think perio has a lot to do with like oral health systemic connection and really understanding the patient's systemic health first, so that you can help patients heal in their pretty much oral cavities, because perio does a lot with gums, and we do a lot of like gum surgeries, which is like flaps, like covering recession areas. We do extractions, implants, a lot of things that oral surgeons do, but I think periodontists have a longitudinal, pretty much patient relationship with people, like because they care about both their, just oral health, but also systemic health. So we take into account in smoking, cardiovascular disease. This is a really big thing for periodontists. So I have an exam.
You have an exam.
There's
So this is Sophie.
Hello.
Sophie also goes to Harvard and matched into orthodontics as well at UCLA. So same thing with Tara, like what are you kind of looking to get out of like the rest of your dental school experience before you head back to the West Coast and leave this cold place?
Yeah, I feel like I kind of have a similar attitude where like I want to get as much dentistry in during this year, because I know that's kind of gonna be about it.
Yeah.
Like I feel like I'm excited to like do more pros, do more crown preps, because I know like especially with ortho, like it's all about like occlusion and like kind of getting a good idea of that through pros stuff is gonna obviously like help a lot. And yeah, also just to be like as good of a general dentist as I could be before I'm a specialist. I think that's really important. But yeah, I'm kind of behind on requirements, honestly, so I still got a lot of work ahead of me, even though we matched.
Yeah. So yeah, that was like the same thing I was saying. It's like this is kind of our last chance to do a lot of stuff. So still getting things done.
Yeah.
I mean, like I was saying, for me, like at my school we get to do Invisalign cases, so I'm looking forward to like kind of finishing out the Invisalign cases I have, or at least as much as I can. I'm kind of excited to be able to focus my time on that since I'm like almost done with requirements, but at least for like here. And I was also saying like at school, like I definitely want to do more remo, like mainly for the impressions part. Even though like your program probably too is like mainly digital impressions, but still like just getting that experience and like aesthetics kind of stuff. Like looking forward to that. And yeah, doing my last few crown preps ever. I'm looking forward to that too. But yeah, I was just explaining that, like, you know, as far as dental school goes, like things are kind of continuing on as normal.
Yeah.
Of course, you can like keep in your mind that like your future career you may only be taking certain skills that you're getting now onto your residency, but at the same time, it's like not much has changed.
Yeah, no, definitely.
So
I feel like it was just like kind of took a pause for like basically just the weekend.
Yeah,
and
just
then
the
now it's like
weekend.
back to doing film.
It was actually a very slow day on externship, and I am back at school picking up the cast that I dropped off earlier. I had Elise pick up the cast that I had Pindexed. I'm gonna have to call her because I'm trying to get into her locker. That's where she put the cast that I had her pick up. And oh man. Okay. So yes, my cast is here. Then I will go to my locker and get my articulator and some stuff that I can take home so I can mount this case at home. And then I will head home. But yeah, that's a good thing about having a community of dental students that help each other out when you need them. I came this morning so I could drop this off, but obviously I'm on externship, so I couldn't pick it up during the hours that the lab was open. And so I had a friend do it, and now I'm gonna get all my stuff so I can finish this work at home. All right, y'all, just made it home. It is 5:20, which means I have a little bit over an hour until our Friendsgiving. I have a little bit of work to do. I'm working on this presentation that I have to do for externship, our community outreach project, and I also need to finish mounting this case that I want to send out before break. So we'll see how that goes. Yeah, not really much else to say. I have a little bit of stuff to do, so I'm just gonna get to it. Gonna head to the Friendsgiving in an hour. Externship was very slow today. Usually Mondays and Tuesdays are slow for us because we have 7 dental students and 2 hygiene students. And on Mondays, there's only 2 providers that we work under. And that's why we started doing half days. Some of the students do half days. Some of the hygiene students do full days because they're only there 1 day a week. And then some of the other students do full days because their externship is shorter. But yeah, on top of that, there's usually 2 providers on Mondays, but today one of them left after the morning. So in the afternoon, there was only 1 provider, and there was 5 dental students and 2 hygiene students for 1 provider. So I did not see any patients today. But I got some good content. You guys got to see Tara and Sophie, who matched into perio and ortho, and get their perspective on, you know, life in dental school after matching. And yeah, I'm gonna get to work and get back on the vlog in a few. All right, y'all. I just got home from Friendsgiving, and truthfully, it's been a day. I still have to finish mounting this case, but I'm almost there. Anyway, I'm gonna end the vlog here because I am about to shower, watch the rest of this Ravens game, do some work, all that good stuff. But it's not really much to show. So, thank you all for watching. I hope you got some insight about dental school, 4th year, residency, and that you learned something new and met some new people. And yeah. With that being said, good night. I will see you all in the next vlog. And be easy. Peace.